Egg intake may increase risk of death because of the heart. On the other hand, regular egg consumption can raise cholesterol, and yet, in contrast, we know that the egg is healthy, one of the best sources of protein, a strong driver of satiety, and supportive for the brain. So it depends on context. It depends on how you intake the egg. That is exactly what I will tell you, how to consume eggs to get maximal benefit, minimal risk, and optimal balance. Egg has undeniable benefits. It is considered a gold standard as a protein source. That means it has a complete amino acid profile, contains all essential amino acids we need for our muscles, and it is easy to digest. Egg is ideal for people who exercise and want muscle building. Egg is highly valuable for the elderly because during aging we lose muscle mass. An egg helps older people reach their daily protein targets more easily, more efficiently, more consistently. Egg is beneficial after illness or surgery because it provides high biological value protein and supports tissue repair, recovery, and regeneration. It is also important for pregnancy and fetal development because a combination of egg protein and choline is powerful for fetal growth, neural tube formation, and brain development. An egg is excellent for weight loss and calorie deficit because it has low calories, zero sugar, and high satiety. It helps preserve muscle, reduce appetite, and support metabolic balance thanks to its high-quality protein and dense nutrition. The first, and one of the most common, mistakes in taking eggs is avoiding the yolk because of cholesterol fear. Generally, this concern is technically understandable. Yes, egg yolk contains cholesterol. But if you intake one whole egg per day, it does not affect heart health, does not harm cardiovascular health, in most cases, in most healthy people. On the other hand, eating unlimited eggs is not recommended. If you eat more than one egg regularly, there may be concerns about cholesterol levels. Yet when you eat one egg, it is important to eat it whole because the yolk contains choline, vitamin D, vitamin B12, selenium, lutein, a dense package of essential micronutrients. And when you remove the yolk, you remove micronutrients. You lose more than 50% of these key nutrients. Choline, in particular, is critical. Choline supports the liver, helping it export very bad cholesterol from the body. Choline supports the brain, helping produce acetylcholine, a key neurotransmitter for memory, focus, cognition. And most people are relatively deficient in choline, which makes egg yolk intake valuable, relevant, protective. So egg yolk intake is safe if you eat one egg per day. If you want more protein, if your protein needs are high, you can use one whole egg and add extra egg whites. More protein, fewer added yolks, balanced intake. The second common mistake is believing that brown eggs are healthier. That is not correct. Shell color depends on hen genetics, not on nutritional superiority. The nutrient differences are negligible unless the hen's feed is specifically modified. In most standard conditions, egg composition is essentially the same. Same protein, same cholesterol, no meaningful difference in core nutrients. There is also a misconception that free-range or pasture-raised hens automatically produce dramatically superior eggs. This is partially true. These hens may eat grass, insects, seeds, and because of this, their eggs may contain slightly more omega-3 fatty acids. But the key point, even when omega-3 is higher, the amount remains small and often not sufficient to meet daily requirements. It is very difficult to obtain meaningful omega-3 intake from eggs alone. The same logic applies to vitamin D. Sunlight exposure in pasture-raised hens can increase vitamin D in the yolk, but the absolute amount remains low. One egg contains roughly 40 international units of vitamin D, while daily needs are closer to 800 international units for many adults. So relying on eggs for vitamin D is inefficient, insufficient, limited. There can be small differences in carotenoids, particularly lutein and zeaxanthin. Village or pasture eggs often have darker yolks, which may reflect slightly higher carotenoid content. This difference is measurable, but not massive. Protein content remains the same, cholesterol remains similar, and overall the nutritional differences are modest, not transformative. The fourth important mistake is misunderstanding egg storage safety. Storing eggs at room temperature is not recommended, especially if the egg has been washed. Washing removes the natural protective coating on the shell. If the egg is unwashed and intact, with its natural cuticle preserved, it can be stored at room temperature for about 1 week, ideally below 20 degrees Celsius. Still, refrigeration is always safer. When stored in the refrigerator at about 4 degrees Celsius, eggs are generally safe for at least 3 weeks. often 3 to 5 weeks. Over time, quality declines, but safety can remain acceptable if storage is proper. As eggs age, several changes occur: loss of carbon dioxide through the shell. The egg white becomes thinner. Breakdown of albumin proteins, weaker structure, poorer cooking quality. Migration of water into the yolk becomes flatter, more fragile. Gradual loss of some vitamins, especially vitamin A and certain B vitamins. Oxidation of fats, particularly in the yolk. Flavor deterioration, reduced freshness. The third most common mistake regarding eggs is the cooking method. Best practice is to eat them gently cooked, ideally boiled with control, not aggressively boiled. A violent boil can crack the shell, over-tighten the proteins, and create a rubbery white. A gentle simmer gives even protein coagulation, better texture, and more stable structure. Egg white proteins coagulate at about 62 to 65 degrees C, while the yolk thickens around 70 degrees Celsius. This temperature window matters. It defines texture, digestibility, bioavailability. For soft-boiled eggs, about 7 minutes is enough. The yolk remains creamy, the white set but tender. For medium-boiled eggs, about 9 minutes. The yolk becomes jammy, stable, structured. For hard-boiled eggs, about 11 minutes. The yolk fully firm, fully set. Avoid cooking beyond 12 minutes. Overcooking can produce a green-gray ring around the yolk. This is a sulfur-iron reaction between the egg white sulfur and the yolk iron. It signals overheating, protein toughening, texture loss, and minor cholesterol oxidation. Not catastrophic, but less favorable, less optimal, less pleasant. Boiled eggs are generally considered the healthiest form. The best balance for health is usually soft-boiled or medium-boiled, minimal oxidation, good nutrient preservation, high bioavailability. Scrambled eggs cooked on low heat with minimal oil remain a good option. Gentle cooking, stable fats, acceptable oxidation. Frying at high heat, especially with butter or excess fat, adds more saturated fat, increases lipid oxidation, and becomes less favorable from a cardiovascular perspective. Not forbidden, but less optimal, less protective, less balanced. People don't know how to remove the shell easily after boiling. There is a clear method, a simple sequence, a reliable system. First, and most important, the egg should be 5 to 10 days old. Fresh eggs peel poorly. As an egg ages, its internal pH rises, and this higher pH weakens the adhesion between the shell membrane and the egg white. Second, use an immediate ice bath after cooking. Transfer the egg directly into ice water and leave it for about 10 minutes. This rapid cooling causes quick contraction, which helps separate the membrane from the white, stops residual cooking, and prevents the green-gray ring from forming. Cooling stabilizes texture, structure, appearance. Third, crack the wide end first. The wider end contains the air pocket and usually has a looser membrane, making peeling easier from that side. Fourth, peel under running water. A thin stream of water helps slip between the membrane and the white, easing removal and reducing tearing. The fifth important mistake is consuming raw eggs, believing they are better for health, better for protein, more anabolic. This is not true. Cooked egg protein digestibility is around 90 to 95%, while raw egg protein digestibility is closer to 50 to 60%. The reason is structural raw egg proteins are tightly folded, compact, resistant. Digestive enzymes such as pepsin and trypsin cannot access the peptide bonds efficiently. Heat denatures proteins, unfolds them, opens them, exposes them. So cooked eggs provide better absorption, better utilization, better net protein. There is also the biotin issue. Raw egg whites contain avidin, a protein that binds biotin, vitamin B7, and prevents its absorption. When the egg is heated, avidin is denatured and biotin becomes available. So cooked eggs provide usable biotin, which matters for hair health, skin integrity, dermatologic stability. Then there is the infection risk. Raw eggs carry a risk of salmonella, a bacterial pathogen that can cause gastrointestinal infection, fever, systemic illness. The risk is low but real, and it is higher for the elderly, pregnant individuals, and the immunocompromised. Boiling or proper cooking kills salmonella, reducing this risk dramatically. Heat protects, heat sterilizes, heat secures. Even satiety differs. Cooked eggs increase satiety more effectively. They digest more steadily, remain longer in the stomach, and provide stronger fullness signals. Raw eggs and shakes may pass the stomach faster, leading to less satiety, less sustained fullness, less appetite control. Salmonella can be inside the egg, but this is rare. It happens when a hen is infected and the bacteria enter the yolk before the shell forms. This is called vertical transmission, infection from inside before protection exists. The second route is more common, fecal contamination. It occurs when the egg comes into contact with hen feces after being laid. Fecal material may contain salmonella, but also other bacteria such as Campylobacter, Escherichia coli, and occasionally parasitic organisms. Still, overall, the most serious and clinically relevant risk remains salmonella. The fifth mistake is not recognizing an old egg. As an egg ages, its structure changes. An older egg typically shows watery, spreading white flatter yolk, less structure overall. This does not always mean unsafe. If the egg has been properly refrigerated, it can still be safe to eat even when older. But once cracked, sensory signs matter. If the egg has a bad smell, an unusual color, or abnormal cloudiness, it may be rotten and should be discarded immediately. A simple and useful method is the float test. If the egg sinks and lies flat, fresh. If it sinks but stands upright, older but usable. If it floats, discard. 6HT mistake. The first and most important risk associated with egg intake appears when you eat eggs daily and you do not know your bad cholesterol level in the blood. Why? Because in about 20% of people, eggs can increase cholesterol levels. Not in everyone, but in so-called hyperresponders, this group of roughly 20%, LDL cholesterol, the bad cholesterol, can rise more sharply, more noticeably, more clinically relevant. That is why, if you eat eggs every day, you should check your LDL cholesterol after about 8 weeks of daily intake. If LDL increases significantly, reduce the number of yolks or switch to egg whites only. And combine eggs with soluble fiber, such as oats and legumes, because in this context, you can reduce, buffer, and moderate the impact on cholesterol levels. The issue is that egg yolk already contains dietary cholesterol. This is usually not a problem if a person is generally healthy, but if someone already has a high level of LDL cholesterol, then even a modest increase becomes clinically meaningful, potentially harmful, and associated with a higher risk of heart disease.